What are the most promising synergistic agents you've encountered for enhancing LDN efficacy, especially from amongst the botanical TLR4 inhibitors?
So the most amazing things that I've seen actually were things that I did not expect, like when you have trigeminal neuralgia and postherpetic neuralgia that is not responsive to pregabalin and gabapentin, it's really impressive when you put them on LDN and the symptoms just kind of melt away, disappear. And you also see it in the old days, we used to call it RSD. Now it's complex regional pain syndrome. But you can actually stop it in progress if you recognize it and start LDN right away. And then there are some acupuncture protocols to calm down the nervous system. So those are amazing. But I also have patients with MS that their neurologists have taken off all medications. I've also seen patients with RA. The rheumatologist stopped all the medication. And the conditions that they call it Parkinson's, I'm not sure it is, but the patient is stabilized now and on LDN. But it's not only LDN with methylene blue, with ketosis.
Because I think there was also the question about botanicals, and I think you noticed in his formula he had a couple of products, curcumin being a big one. Yeah. That was a huge one. PEA, which is palmitidyl amino aditate, that's another supplement. Yeah, PEA, everyone's like, oh, PEA. And then one of the other big ones that we always see is like the omegas. And magnesium glycinate as an oral supplement, not the oxide or other magnesium components. Yeah, he agrees. Wow. Okay.
And I agree, and we can combine all of those. So in fact, I do. But we want, as clinicians, you can test them. Every single one of my patients gets an omega index. So in America, we eat the standard American diet, and the average omega index is, in my clinic, 3 to 4%. The optimal percentage is 8%, which is a percentage of EPA plus DPA plus DHA. And we also can get an omega-6 to 3 ratio. And when we talk about ancestral humans, there's a ratio of anywhere between 2 to 1 to say 4 to 1 as an optimal ratio. The average American is sitting at 20 to 41 to 1. And we can also, and that's because of our seed oils and just our junk food. And we also see, so again, improving that alone is huge for our nerves and huge for just our immune system and chronic inflammatory state. We measure arachidonic acid to EPA levels, and we see those ratios shift. I have 16-year-old girls with hellacious ratios. I mean, they're in terrible pain, but they're so inflamed. And just that one, the omegas, and then I will add LDN with high-dose PEA. There was a product that beautifully combined PEA and CBD, and so I have to do it separately now, but I will do CBD and PEA and LDN, and I find that to be amazing. I use boswellic acids, curcumin. I have a very close colleague who provides acupuncture for my patients. I think all of that, and methylene blue. I also just wanted to say on the methylene blue front, so it's amazing. But the methylene blue, make sure it's compounded from a reputable source. Do not have your patients just getting it on the internet, because remember, this is an aniline dye. It was actually used by the OG people who were figuring out, looking at anthrax under the microscope. They were dyeing these bugs, with methylene blue, saying, oh, it killed the bug, cool. We can use it for malarial infections. But it's a dye, and if you use high doses of it from an unreputable source, it can have high amounts of impurities, heavy metals, etc. And as a clinician, we have licenses, so use it from a proper source.
I'm just going to add to that. This was a concern that we do see, that people will buy it off of the internet, and we're not going to say a specific company that ships everywhere, but you can register that your company and then just provide an industrial version of it and put whatever label you want on it. And so we see impurities like the heavy metals, lead, arsenic, and so we really do want to avoid those. And I know we get a lot of questions about that. So, and you mentioned it in your talk.
The methylene blue is fascinating because at lower doses it reduces, but higher doses it oxidizes. So what I tell patient, of course, is purity. You don't want to protect your brain and deliver mercury. That just doesn't make sense. And the second is the dosing is going to be highly individualized. So I start out same as LDN, 1 milligram. Some of the sensitive people 0.1 milligram, and then just go up to maybe about 25 milligram 2 times a day, and that's where the antimicrobial action will begin, likely. And so for like patients with Lyme, that's like perfect dose to have it about there, and then let them figure it out. Can they do it 2 times a day? Can they do it 3 times a day? And then can they do 50 milligrams 2 times a day? So the Paracelsus said dose makes poison, and some things like methylene blue, I think that's true, and the same thing with the rapamycin. In rapamycin, you really have to be careful because it's used as an immune suppressant.